All right, we're going to wrap up our lecture on radiographic evaluation and classification of acetabular fractures from the OTA Core Curriculum Resident Lecture Series, version 5, by Drs. Laura Blum and Jeffrey Chad Martin. I'm Saqib Rahman narrating, and this is the 4th out of 4 videos on this lecture slide deck. We are going to wrap this up by talking about CT scan evaluation. The objectives are to understand how to evaluate associated injuries, recognize patterns on CT scan, and how to further characterize fractures. And then we're going to talk a little bit at the end of how you might be able to use an algorithm to help identify fractures by classification. So CT scans are helpful to look for soft tissue injuries, such as the Morel-Lavallée lesion. Here you can see on this CT scan, you can see that there's a fluid collection here that is a Morel-Lavallée lesion that can be examined, picked up on physical exam, but confirmed on CT scan, and sometimes hard to examine and is picked up on that CT scan that oftentimes the trauma patient comes in with. You will identify genitourinary injuries. You will also identify other orthopedic injuries, pelvic hematoma, other pelvic ring fractures, sacral fractures, contralateral rami fractures, and of course you can also evaluate the femur and the femoral head. It is helpful to have a dedicated pelvic CT scan with 2 to 3 millimeter cuts. It's difficult to really just look at CT scan in isolation. It is helpful to look at this in conjunction with plain pelvic radiographs. You also have to keep in mind that when you are getting follow-up imaging on these patients in your office, oftentimes it's going to be with plain films, right? So it's good to have a baseline to correlate with. On your CT scans, axial cuts provide probably the most information regarding the relationship of the fracture line to the articular surface. Now, when you're looking at that fracture line on the axial view, column fractures usually have, like an anterior column fracture, for instance, it usually has this horizontal coronal kind of orientation most of the time, whereas transverse fractures are a little bit more vertical. And then wall fractures, like a posterior wall fracture, will frequently look something like that. Now, the anterior wall fractures, as I mentioned in the first video, are not necessarily the sort of homologue of the posterior wall fracture. It's usually a different type of fracture fragment. But if you have like an anterior wall fracture, it could look like that. So certain things we talked about earlier are really very well seen on CT scan and hard to see on plain X-ray, like marginal impaction. So marginal impaction is in the posterior wall, very hard to see. Sometimes in the dome, in those geriatric patterns with the anterior wall fractures, and I talked about earlier how those can be a poor prognostic sign, and you get that gull sign. That's actually an X-ray finding. But marginal impaction, especially the posterior wall, can be a little harder to see, and CT scan shows it nicely in the blue line there. And we've gone over this phenomenon already in previous videos, but just to reiterate, normally that articular fragment should be, that joint surface should be here, and instead it is there. So that's the marginal impaction compared to the contralateral side. Intra-articular fragments are also seen as shown with the gold arrows in the upper image. You can better assess fragment size, fragment displacement. Reduction of the femoral head, is it concentrically reduced, is it subluxed? You can see that on plain film also, but CT scan can show it a little more precisely, as well as femoral head impaction and other minimally displaced or non-displaced fracture lines. The subchondral arc is a method used to assess articular congruity, as shown in this image here. If you can identify how thick your CT scan cuts are, you can then identify, for instance, with 2 millimeter cuts, it should be 5 clicks of your mouse or 5 images down to get through the superior weight-bearing dome of that of the acetabulum. This is a way to sort of get the same information you would sometimes get with roof arc angles that we talked about previously. 3D recon. So we have been looking actually in some of the previous videos of iliac and obturator oblique views that I believe were not actually radiographs, but they're actually CT scans, 3D recons, which are then kind of reformatted to make it look like an X-ray, right? And that's actually on the bottom, I believe, a 3D recon. And on the top, it's the same 3D recon probably, but shown as sort of like a bone model, which a lot of the software will render for you. This is really helpful. This can really help show your fracture pattern, how it would look intraoperatively. I mean, a lot of times we use bone models to best understand the real anatomy, and especially if you're new or you're a trainee and you're going into a pelvic or acetabulum case, it can be really helpful to get your hands on a model. Well, you can make your you can make your patient's imaging look like a model also by doing 3D recon. So this is really helpful to understand the fracture pattern and to recognize where your surgical approach is going to get you relative to what the fracture looks like. So I think these are really helpful, and whenever possible, you should utilize this if your CT scan software allows you to. So let's talk a little bit about a classification algorithm. So there are some ways that you could determine the fracture type, maybe not based on just pattern recognition, but by using an algorithm. So for instance, if you want to assess it this way, you would first determine, is there involvement of the ilioischial and iliopectineal lines on your radiographs? If they're both disrupted, you probably have one of those fracture types on top. And if only the ilioischial line is disrupted, then it's probably something involving the posterior column. If it's only the iliopectineal line, it's probably an anterior column fracture, and so on. So if both lines are disrupted, we can say it's one of these types. The next thing you can do is then evaluate the obturator ring. Is it intact? Is it disrupted? Remember, we said that in a transverse fracture, the obturator ring is intact. In a T-shaped fracture, it's disrupted, for example. Evaluate for involvement of the ilium. Evaluate for the spur sign. Remember, we said that that true spur sign is something you see only with an associated both column fracture. So here's kind of an algorithm to think about what I just kind of went through. And I won't go through all of this, but you can certainly pause the video and take a look and make sure this makes sense to you. I don't think this is something that you have to memorize. In the next several slides, are going to show more of these, but I do think that this should make sense to you. You should go through this, and hopefully if you understand the fracture classification, then you can use something like this. If only the ilioischial line is disrupted, then you have to identify is there a posterior wall fracture or not, and then you have one of these two types. If neither the ilioischial or iliopectineal lines are disrupted, then you have to look for the fracture on the iliac oblique view and then on the obturator oblique view, and depending on what you see, it's going to be either an anterior posterior wall fracture. If only the iliopectineal line is disrupted and nothing else, then you probably have an anterior column fracture. And if you put it all together, and you know where to look for these ilioischial and iliopectineal lines, which is really, really basic and elementary, and from our first video, and hopefully you can go down this pathway and help identify your fracture pattern. And a lot of times you will be asked, like on an exam question, what is the fracture classification? It's one of the cases where we don't really ask a lot of test questions on fracture classification, except for acetabulum fractures. So you should really, really know it. So in summary, the 3 radiographic views for every acetabulum, or your AP and your 2 JDA views, you're going to look for these 6 radiographic landmarks as outlined here. Going back to our first video. On the obturator oblique view, you're looking at the anterior column and posterior wall. On the iliac oblique view, you're looking at the posterior column and anterior wall. Here are the 10 fracture types in the Letournel classification. You have your elementary patterns, which include sort of these single column fractures, and then you have the transverse fracture, which is sort of a nice pure elemental sort of fracture, so it's included in there. And then you have the associated patterns, which generally involve a couple of different elementary patterns, or an elementary pattern with something else involving multiple columns, etc. Remember where the axial fracture line is going to, what that's going to indicate as visualized on axial CT scan with respect to the different fracture types as shown here. And then make sure that this algorithm makes sense to you in terms of identifying the ilioischial and iliopectineal lines, and then breaking it down from there, and then asking yourself those other questions as we went through at the end of that section. All right, so that wraps up our lecture on radiographic evaluation and classification of acetabular fractures. Thank you.